name is Scott Wolf. I'm a physician by training. What I do is invent and develop medical devices. When I was practicing medicine after medical school, I was an intern. Patients came in and they all had congestive heart failure. A lot of them had arrhythmias, a lot of them had coronary artery disease. The way that we treated those was very similar patient to patient. I thought, boy, you know, there has to be a better way of developing new therapies. One of the most consistent things that happens to us as we age is we get fat deposition. And there's two kinds of fat. There's subcutaneous fat and then there's visceral fat. And we're not talking about subcutaneous fat, we're talking about visceral fat. And visceral fat is the fat that's in your abdominal cavity, in your chest cavity. So it's around the heart, it's around your organs, it's around your blood vessels. And what does it mean that we have so much more fat around those organs now than we did when we were young? And what I think it means is that there's a potential that that fat is actually causing a dysfunction in the organs and the nervous system. So fat produces all these chemicals called cytokines. Those cytokines and other chemicals are inflammatory. So what happens when the visceral fat that's surrounding, say, the heart, inflames the heart and inflames the nerves of the heart? What does that mean for our body? So since we have medical devices that could potentially affect fat, that's what our team's going to look at. My involvement in the Palo Alto Prize, I lead a team, one of the competitive teams. I also see this whole process as a collaborative process, so I hope that the teams can collaborate. Each team has strengths and weaknesses, so I'd like to offer my strengths to the other teams as a resource for them. This prize really illuminated how important heart rate variability is and what a great marker and measurement it is. I've been interested in heart rate variability for a while, and the reason is because there's so many metabolic problems, and I think those metabolic problems in the body are due to the autonomic nervous system, a mismatch between the parasympathetic and the sympathetic nervous system. So our fight nervous system and our relaxed, let's nap and eat nervous system. That imbalance leads to things like congestive heart failure. It leads to all these problems in the body. And since I developed medical devices, I always thought it would be interesting to start looking at what medical devices can do to treat these metabolic problems. And heart rate variability is a great measure of the balance between the sympathetic and parasympathetic nervous systems. So it's relatively easy to measure. It's conserved across species, so if you can get it to work in mice, you can get it to work in humans. All the males in my family for generations have had heart attacks and passed away even in their 50s. My father was probably he passed away at 79, and he was the longest living male in our family. There's a saying that I love. It's called, whatever you can do or dream you can do, begin it. Boldness has genius, magic, and power in it. Andrew is our team vice president of research and development, and Andrew and I have worked together for 5 years. I think our team's very strong. I think our idea is novel. People have been looking at visceral fat and correlating it with problems, longevity, arrhythmias, other metabolic problems. No one's actually gone after it therapeutically. Some of my main questions are, do we have to face diabetes as we get older? Do we have to face congestive heart failure, atrial fibrillation, things that really affect arthritis, things that really affect the quality of life? We can build a foundation for solving the aging problem now, so why wait?